Okay, welcome everybody to the TRI Consumer Involvement event. Really grateful to have everybody here and online. And what I might do is do a little bit of an explanation because it's a little bit of a hybrid situation. So we are in the TRI auditorium at TRI, the presenters, but we do have two presenters who are also online. But because of the current COVID wave, we made a decision to have all of the participants online. So there are more than 100 people online today. So for the presenters in the audience, although it may seem like we're talking to each other, we're actually have more than 100 people represented online. So on behalf of TRI and Scott Bell, our CEO, and also the shared leadership team across our partners, which is the University of Queensland, QUT, MARTA, and also Queensland Health, we welcome everybody today. I'd like to start by acknowledging the traditional custodians of the land on which we all are on today. And at TRI, that's the Turrbal and the Jagera people. We recognise their continuing connection to land, waters and community. And we pay our deep respects to them, to their elders, past, present and emerging. And we acknowledge all Aboriginal and Torres Strait Islander people who are here with us today or online. So today is a really important event for TRI. This is the beginning of the journey for many researchers and others in the TRI building to build our connection to consumers and actually more importantly to the community. So it's very important to TRI that we as researchers and clinicians who are associated with the TRI form relationships and deep and important and real relationships with the community so that we ensure that what we're doing here, which is translational research, so trying to improve the health of our community through the translational pathway, that in every step across that pathway, we are involving the people that matter the most, which is our community. And so that's very much at the forefront of our minds. We want to ensure that, you know, the contribution of consumers in health-related research across the entire translational spectrum, and bearing in mind that there is a whole raft of biomedical research which occurs in this building and across our partners. We are really endeavouring to ensure that we better understand, that we respect, and that we're fully utilising the skills and the opportunities that the community can provide to us through consumer input, through both organisations and individuals. And so that's what today is really about. I'd first of all like to thank Benny Watson, who's been integral in the consumer program, developing the consumer program at TRI, and instrumental in forming the links across this important initiative. I'd like to just tick over here to let you know the program of events for today. So we're very lucky to have Ann Mckenzie, and I'll introduce Ann in just a moment, who'll speak to us today across her broad-ranging experience of consumer involvement across the research spectrum. We'll have a number of other speakers, including Jessica Taylor, a consumer advocate, who'll also give her perspective, and Rick Thompson, who's a research lead here at QT, will give his perspective from a research point of view. I hope to have a very vibrant Q&A panel following that, where we'll invite, and I'll introduce all of the panel members a bit later on to really have some robust discussions on the things that we could be and should be doing together, and the ways in which we might look to doing that in this space. So I'd like to introduce Ann, and Ann Mckenzie AM has held professional and voluntary roles as a consumer advocate for more than 3 decades. She's worked in research organisations to increase community involvement in research since 2004, where she commenced at the University of Western Australia and Telethon Kids Institute. In this role, Ann developed and implemented organisational frameworks for community engagement, facilitated training workshops for researchers and consumers, and published resources. Ann is a member of Health Consumers Council Western Australia and the Consumers Health Forum. She serves on key national health and research committees, and in 2015 was appointed to the Order of Australia for her advocacy work in this area. Ann received the NHMRC's 2021 Biennial Award for Consumer Engagement and the Advocacy Achievement Award from the Australasian Academy of Cerebral Palsy and Developmental Medicine in 2022. So thank you, Ann. Just give us a couple of minutes while we bring you up on the screen here. Okay, Ann, if you come off mute and kick off, we should be able to hear you.
Great, thanks very much. I'll just share my screen. I sincerely hope that's working. Is that working?
It is, Ann, that's perfect.
Yeah,
we can
fabulous.
see you and we can see your slides.
Fabulous, thanks. And look, thanks very much for having me. I'm always happy to come and have a chat about my experience, and I'm really, really pleased to be here today. As you start on this really important journey, it's great to be here at the beginning. So before I start, I'd like to also acknowledge country, and I'd like to acknowledge the traditional owners of the land I'm on, the Noongar Whadjuk people in Western Australia, and pay my respects to their elders past, present and future. So today I'm going to be talking about a little bit about my journey and where it started for me, consumer and community involvement. I'm going to talk about the what, why, who, where, when and how, and I'm going to give you a few tips and some training suggestions, and then the barriers and benefits and some concluding thoughts. So I'll get started because there's a lot to get through. I'm just making sure that I don't go over time, but Helen, I'd really like to make sure that you keep me on track if I am, thanks. So for me, it started when my daughter Emma was born with a disability in 1979. So Emma is independent, sort of. She would say she's very independent, but I would say not so much, perhaps. We lived in rural WA, but had to relocate back to Perth to have better access to health services when Emma was 3. And then in 1994, I became the first parent advocate at Perth's only tertiary children's hospital. And that was a role that was very special for its time in the 90s, that they didn't want a health professional or a researcher or someone that worked in the health service. They wanted someone who had lived experience, and I was really grateful to have that job for over 5 years. Then in 2004, again, I was very, very fortunate to become the consumer advocate at the University of Western Australia and Telethon Kids Institute. And they had started a program in 1998 looking at linked data and about the fact that people in the community didn't know that the government, the health department, was linking people's routinely collected data. And the Health Consumers Council were very concerned and thought Big Brother had come to live in Perth. So I commenced in 2004 to take up that program and formalise it. And I was employed by a research grant to increase, it was called participation at that time, in linked data research. It was the first formal program of its kind in Australia in a university, and that meant for me there was limited support, and sometimes it was quite lonely. But fortunately, I had amazing bosses. On the top there is Darcy Holman. You may not know him, but he actually started the linked data capability in Western Australia, which is now available across the country. And of course, Fiona Stanley is, has been a wonderful mentor to me. She was Australian of the Year in 2003. And both of those bosses were just amazing in getting it started. And they often say, what a difference we all made to the landscape of research and involving consumers. So talking about the what, I want to just put it out there that I'm going to use the word consumer and community members today. That is the definitions put forward by the National Health and Medical Research Council. And there's lots of names. And to me personally, it doesn't really matter what it is you call people, whether you want to call them patients or co-leaders or research partners. It doesn't matter. What matters is that you have the voice of the community in research, and that's where we can all contribute as consumers, community members, to make sure that research suits the needs and wants of the Australian community. So what is consumer and community involvement? I believe it's when consumers or community members work in partnership with researchers to make decisions about research priorities, policy and practice. So it's about being part of those decision-making processes. The partnerships are sensitive to the needs of the community, and research is conducted with the community rather than to or for them. And then, of course, there's advocating together, researchers and community members, for research results to make a difference to policy and practice and ultimately improve health outcomes. What it's not about is researchers raising awareness of their research, the participants, or used to be called the subjects, taking part in the research. It's not a recruiting tool, although often if you have consumers and community members involved in your team, involved in research teams, researchers will find that recruiting is improved. It's not an opportunity for ticking boxes, and it's certainly not fundraising or public relations, both of which is very important, but we're not talking about that here. So this is, something that we developed at Telethon Kids and UWA a very long time ago, and it's a complete stakeholder wheel, more or less, of all the people that are involved in research. And, it's researchers, community members, commercial or industry, funding body, clinicians, non-government organisations, health administrators and policymakers. Unfortunately, what happens is that until now, and I do see a huge difference in the landscape, consumers and community members have been represented more or less by people who speak on their behalf rather than having their voice in there. So when I talk about what is it, this is what I'm talking about. So what's the difference? Just to clarify, for this particular presentation, participation is about people participating in a research project. Involvement is about that shaping decisions and being at the decision-making table. And of course, engagement, which is sometimes, used instead of involvement, but we tend to use it as respectful conversations and activities between a research organisation, a researcher and the community. So why do we need to do it? So there's lots of reasons for it. Probably the most important thing that it's the right to have a say in taxpayer-funded research and, to make sure that that research suits the needs of the community. Funding bodies require some form of involvement. That may be why people choose to do it. Consumer and community involvement will help to enhance or improve the quality of research. And there are lots and lots of publications now and people's anecdotal experience to say that that's the case. It may be an accreditation requirement. Very shortly, all clinical trials that are conducted in hospitals will need to address the National Safety and Quality Health Service standards. It may be an ethics requirement, particularly in the case of Aboriginal and Torres Strait Islander research. And of course, there could be community expectations. From my perspective, having consumers and community members involved in research is about getting the whole picture. Without it, I don't believe you can conduct research that is fully based on the needs of the community. So by now you will have gathered that I'm a bit of a purist. So I never move off that message, and I think that's been something that's stood me in good stead. So who do you do it with? Well, of course, it's consumers, and that can be patients, families and carers, community members, and that may be someone who is involved in an organisation, It may be just people from the general public who have an interest in research. They may have known about it, they may have a relative, and they may not necessarily have their own lived experience. And of course, then there's members of the public. And we've seen how the public has really become more and more interested and knowledgeable about the benefits of research and the importance of research during COVID. And of course, there's lots of examples in public health examples where the community wasn't involved and it didn't go so well. So I think when you're talking about who to involve, it's really important to use the links to the community. And my local networks grew from forums and linking into existing contacts and groups that I developed way back when I was the parent advocate. When I first started in this role, that was how we started to grow a community of people that were interested in the research at the two organisations. My national networks were established by being members of committees, and this is where my bosses, Darcy and Fiona, really encouraged me to join national committees to put forward a perspective from the consumer point of view, but also to bring back, to the organisations information about what was happening on the national scene. And then I was very, very fortunate to develop international networks. And I know that some of you here today have those international networks. And when I first started, a very big supporting group was involved in the UK. And there in the bottom right-hand corner is me. Thankfully, before we had COVID, when we could go to conferences in person, and I was at the Involve conference in 2017. So where can you be involved? And for those of you who know about this, I'm talking to the converted, but for those who are new to this, it's possible in all stages and levels of research. And this is a couple of diagrams we use in training for researchers about how to involve consumers, but they're relevant here because what they can show you as a consumer rep where you might be involved. You might be involved when they're deciding what to research or how they're going to do it. When they're doing it, a lot of people think, well, I can't really do that because I'm not a researcher. But you may talk with the researchers through there and help them if they come up against any issues, analysing the results. And then, of course, letting people know the results. There's a huge role for consumers to play in that part, and then knowing what to research next. And what you will find, you may only be involved in one part of that cycle, or you may be involved in all aspects of it. And then over on the other side is just a diagram that's taken from the International Association of Patient Organisations, and that is the involvement spectrum, where a researcher can tell you whether you are going to be just informed, and it's not just informed because sometimes that's important. You're going to be consulted, advised, equal partners to co-lead the research, and so forth. So those diagrams can help you understand where you might be involved. So is it suitable for all research? I often have researchers, not so much now, but in the past saying, oh, it doesn't fit for my research. Well, I think that's not true. I think all research can have an aspect of involvement, and it's about sorting out what's the most appropriate way to ensure the research effectively includes the community voice. And I've got a picture there of a cancer lab researcher with two young students who were on the youth advisory group at Telethon Kids Institute. And they were talking with him at the point where Cancer Australia brought in a requirement for consumer involvement in research. And it really changed the face of research because all of a sudden lab-based researchers were having to, talk about how they intended to involve the consumers in their lab-based research. So back to this research cycle, I just want to give you some quick examples of various activities from Western Australia again. And the reason I share these is because I know these have worked and had, you know, an impact, but I do have some other national examples that I'll share with you in a moment. So I just want to talk about the first stage, about knowing what to research. We at Telethon Kids developed a reward and recognition program called Telethon Kids Connect, and it was about acknowledging the huge contribution that consumers and community members make to the research at Telethon Kids. And just to say, currently there are over 500 consumers and community members on decision-making committees. And we wanted to say thanks because many of them help with grant applications and help researchers develop questions, etc. The next one is deciding how to do it. Community conversations have been something that I started in 2009. And by the time I finished in 2021, you know, I'd facilitated over 100 community conversations. They're based very loosely on a World Cafe model, and the particular researchers that are sitting there, they had a community conversation with members of the support group, and they wanted to do a sleep study on the muscular dystrophy support group and the young men that were having difficulties with their sleep. And they wanted them to come into the hospital, and at the community conversation, their parents said, "We think this is really, really important research, but is there any chance you might be able to do it in our home?" And they sort of thought about it for about 2 minutes and said, "Well, we can give it a go." And it was very successful, and more people were enrolled in the study than what they initially planned because they fitted into the needs of the community. And then actually doing it, community researchers, and those of you who work with Aboriginal and Torres Strait Islander communities to conduct research, you'll know the value of community research. And this is one from the north of Western Australia, and it's about scabies. It's called the STOP trial, and it's see, treat and prevent scabies. And they worked for 2 years to skill up the community researchers and, you know, get buy-in from the community so that when they opened the recruitment of that trial, they actually had the majority of the community members sign up straight away. Then, of course, letting people know the results. We've held expos and seminars where people can come in to various places in the Institute and hear about the results of research that they may have contributed to. And finally, knowing what to research next. Priority setting projects have been a great tool that we've developed based on the James Lind Alliance from the UK. And I've just very recently completed one for a national support group here across Australia. So, you know, they've been a fabulous thing so that the community has a say in the research agenda going forward. So how do you do it? So making a difference is what's important, I think. Currently, there are hundreds and hundreds of people involved in decision-making activities in research across Australia. And I put some of the logos down the bottom. You know, the AIDS Trust, they were the forerunners in making sure the community had a voice in research in the 80s. Then, of course, there's the breast cancer networks. They've been amazing in developing programs like Seat at the Table and the National Breast Cancer Alliance, etc. Mental health, consumer-led research network has been, you know, really instrumental in talking about co-design of research. And Asthma Australia, they have consumers in all aspects of their work, and you know, they're looking to increase that. And then, of course, there's the Aboriginal and Torres Strait Islander community working with the National Health and Medical Research Council to produce roadmaps for research, and another one is keeping researchers on track. So I think you can see that they're the sort of activities that consumers can take part in, and they can be as small and large as what you want them to be. the next thing I want to talk to you about, these are ways that we developed to involve consumers and community members. And when we started with developing these methods, we had advisory councils at both organisations I worked at. And I use the we because there are hundreds of people that were helped to develop all of the work that I'm talking about. It's not just me. I've been fortunate to be recognised as the person who's driven it, but I also see it that I drove it on behalf of, you know, the many hundreds of community members and researchers that have helped develop the program that we have in Western Australia. So I always say to researchers, these are things to consider. If you're involving one or two consumer or community members, and I would always advocate for two, that you would have consumer or community team members. Some people call them representatives, but I don't think you can represent anyone. I think you bring a perspective, and that's why I choose to use the term team members. Research buddy is something that we nicked from the UK, really great in bringing back, you know, good practice initiatives that I've seen over there. And that was where a charity was providing money to lab-based researchers in particular for their particular condition. And they said, we don't really know enough about what you do with the money that we provide you. It's quite different in the UK, or it was. I'm not sure that it is now so much, but you know, the charities fund a huge amount of research, much more than what they do here. And so they developed a process of research buddies, and they had two people with the condition go and meet 2 or 3 times a year with the lab-based researchers. There was a bit of pushback from the researchers to say people won't understand the science and they won't particularly be interested in it because it doesn't immediately affect their condition. But the charity said, well, we fund your research, so basically you have to do it. So they did it, and exactly the opposite happened. The funding, the research buddies, you know, encouraged the charity to provide more money for research in particular areas where they were involved. And it was very successful. And when I heard about it, I thought it would be perfect for linked data research because they, you know, there's no particular person or even condition. It's population-based data. So I thought it was great for that, and we used it very effectively. And then, of course, when, as I said, funding requirements changed and lab-based researchers were required to do more with the community, then research buddies have been a very popular way of encouraging the consumer voice into lab-based research. And I'm pleased to say the Walter and Eliza Hall Institute in Melbourne picked this up, and they have a whole program of research buddies, and they employ someone to facilitate that program. So it's a very popular method. I've talked about community researchers, and then if the research is going to be involving a larger group, you might have a reference group for advice, or you might have steering groups or advisory councils, and those groups are usually at a higher level in the organisation, particularly councils. And steering groups really steer the research, and they will often have external stakeholders on. And then finally, involving the wider community, and this is an opportunity to do that. As I said, I've talked about both of those methods that we developed, and they've been very successful with community conversations at the start of a research project, or even at the end about sharing the information that's and results from the project. And I've talked about the priority setting partnerships. So they're just some ways that we've developed, and researchers and community members can be involved in a little bit of it. You might be involved in a reference group, but you might also choose to be a research buddy on a particular program. So it's just about, as I said, sorting out what it is that's wanted for the particular research. So I'd just like to share some good practice examples, and that's a gentleman there who has been very involved in cancer research in Western Australia, and that's his son. So, a fabulous photo. I love that picture. So in 2020, I was hearing both nationally, locally, and internationally that research for a rapid COVID-19 research was being conducted with absolutely no voice from the community. And people thought it was going to be too hard. And so I talked to some senior researchers at the University of Sydney, at Telethon Kids, and some consumer advocates or their patient and public involvement consultants in the UK, and decided to, with permission from my director at the time, that we would establish a national community advisory group. Now, we did something that I don't normally do. We tapped people on the shoulder from across the country. We wanted this to happen very quickly. I invited 24 people to join this group. It was going to be funded by Western Australia, by Telethon Kids Institute, actually. And it was mainly in the beginning for WA research, but we wanted to get a wider perspective because we knew there was no COVID in Western Australia, but there was in the other states. So I invited 24 people, as I said, 22 accepted it, ranging in age from 20 to 70 plus. And we had, people with a range of experience: respiratory cancer, diabetes, heart conditions, cystic fibrosis, etc. And then, of course, there were Aboriginal. We had two Aboriginal members, and it was just a fantastic group that came together within a week. We had acceptance from people. We had signed off on terms of reference and confidentiality agreements, and we had our first meeting. So that group met through 2020 and 2021, and it's met a couple of times at the beginning of 2022. So I think it was an exciting group, and you'll see we did have someone from Queensland, and we had 3 people from New South Wales, 1 from the ACT, 1 from Vic, 1 from Tasmania. And unfortunately, in the middle, the 2 people we invited, they couldn't join because of their own personal circumstances at the time. But it was a fabulous group, and the researchers really appreciated this high-level group of people that were sensible and could offer advice. And we met virtually, I think something like about 24 times over the period that it's been running. It's just in hibernation now, in case people decide they want to come back and consult with them. So diabetes research, this is an international children's diabetes centre. It's integrated clinical and research centre. In 2015, they had a community conversation and established a community reference group. They have research buddies on project. They have Telethon Kids Connect come and have a cuppa event to meet community members, to meet the researchers and talk about the research that's happening. And at the last one, they had about 40 people came. People signed up to be part of trials. They signed up to be part of involvement activities, and they've employed a consumer advocate to support the involvement activities. So BeatCF, this is a national project run out of the University of Sydney and in partnership with Telethon Kids. It's an adaptive clinical trial evaluating a range of treatments for cystic fibrosis patients. That should say consumers are a CI and an AI on the project, and a consumer is employed to support the involvement activities. They have 3 national community advisory groups with members from adults, youth, partners, parents and carers. And the advisory groups have provided input into all aspects of the project, including the design of electronic consent processes, because this trial has been running at the same time as we had COVID and continues to run, and we continue to have COVID. So it's really important that, there's electronic consent process available, and the secure storing of identifiable data, because, you know, cystic fibrosis in Australia is quite a small community, and people wanted to make sure their privacy was protected. So this is another national project run out of Westmead Children's Hospital and Telethon Kids Institute, and the West Australian Alcohol and Drug Authority have been involved in it as well. And they had over a decade of community involvement in all studies. There were alcohol and pregnancy projects which really highlighted the need, particularly in the north of Western Australia, for bringing in low-strength alcohol and reduced times people could buy alcohol. There were partnerships, very strong partnerships with Aboriginal communities. There was the development of a diagnostic instrument that took into account community needs when kids were being diagnosed with fetal alcohol spectrum disorders. And there were justice projects for kids that end up in the justice system that have the disorder. They had a National Centre of Research Excellence, and there was a national community reference group with memberships from all states. They did a priority setting project so that all of the research met the needs of the top 10 priorities for the community. And then they've established an information hub, which is still going on. And those of you in Queensland may well know and have contributed to that FASD hub. So this is a Queensland example out of a collaboration between the University of Queensland and Telethon Kids Institute. On the left, we did a partnership project, a Train the Trainer project, to train I think there's 8 researchers and 3 community members to deliver training to cerebral palsy researchers. And that is something I'm very proud of. These women, they are all women, were amazing in picking up and running the training. I'm one person that's been offering this training for many years to researchers. And, you know, COVID made me develop virtual training. And but it's really exciting that UQ and Telethon Kids came together to do this Train the Trainer project. And one of the people who is a UQ researcher is running a project to help kids with CP experience the thrill of running. And they've developed running frames for these kids. And they had a community reference group, and they had advisors from young people, parents and carers, all the way through the project. So that's just a local example to share with you the things that have been done and what you could do. So what I'd just like to do now is to share with you some points. These are my points, and some points that you might want to think about when you're starting out, or you might want to consider if you're already doing it, and if perhaps some of these might raise some questions for you. So is the partnership with researchers and other stakeholders balanced? And by I mean that you don't want to have one consumer or community member and 20 other people, because that can be very daunting. So that's why I've learnt over the time that 2 or more is always better. So will your expertise be valued? Do you have any conflicts of interest? These are things that are really important for you to think about when you're starting out. Are there clear roles and responsibilities? Is there support or resources available for me to look at before I make a decision? The next one is a big elephant in the room. Will I receive an honorarium payment? And I know that Health Consumers Council Queensland advocates for the payment of consumers and community members, because often consumers can find themselves as the only person at the table who is not being paid. Now, that's not to say you have to accept it. You may decide you want to volunteer your time and you don't want any payment for your time or out-of-pocket expenses, and that's okay too. This is a personal decision, but I really advocate for researchers to budget for this in their grant applications and for organisations to make that available. Will there be recognition of my contributions in publications or at conferences? And that's something that you may decide that's enough for me, and that's okay too. And then, you know, providing a wider perspective when it's required. You know, those higher level committees that I talked about, you may be on the Consumer Advisory Council. I don't know if you've got one, Helen and Benny, but, you know, I'm just using that as a hypothetical. And you might, for that one, it's not about your own personal experience so much as about the links to other consumers and community members that will enable you to provide a wider perspective if required. And that's what's really important for you to nurture and look after, those links to community and other consumers that you might have. So access training, it will help build your skills and confidence. There's a lot of training around Cancer Australia offers online training, and Telethon Kids. Before I finished there last year, I developed with my colleague Belinda Frank an online free training for consumers and community members. And that is where you can access it. And these slides will be made available afterwards. I believe you may have been sent it as pre-reading. If you haven't had a look at it, you might want to have the time, take the time to have a look at it. And also please share it with anyone that you'd like, because it is free, and that's what it's available for, is to build your skills and confidence if you are starting, and if you are already doing it, there's always something that you can learn in this space. So the barriers to effective involvement. When we run training workshops for researchers, we get them to tell us what their barriers are. And these are some of the things that they've been putting up for years. I've been doing researcher training since 2009, and I think we've done nearly 200 training workshops with researchers. And there's a very common things that come up, time and money. And I say to researchers in response to that, you have to allocate in your budget money for involvement. It doesn't come necessarily for free. So, and you know, you need to put the time aside exactly the same as it is for any other part of research. They say they have a lack of confidence and knowledge about how to start. And so the training workshops that we run hopefully builds that. But these are things that you may need to think about when you're engaging with researchers. They say finding the right people, and this is where you can be invaluable with your contacts and networks and community groups. And of course, then there's a lack of support from funding bodies to effectively engage with community. And particularly, I've been doing a bit of consultancy work since I finished full-time work. And I've been hearing from Aboriginal community members and Aboriginal people who conduct research with Aboriginal people and Aboriginal researchers all say there's not time in the current funding process, grant application process, I should say, to engage effectively with the community. So that's something that really the funders need to address. So I think it's important to take the time to discuss any issues or barriers as they rise. So look for them. And I would really encourage you to look for win-win solutions. And the success of all of this is about building strong relationships with the research team or the research organisation. It's all about relationship building, and you all do that very well in all aspects of your life. So this is exactly the same. So what are the benefits? I mean, it's pretty obvious. It's improved openness and accountability for the use of public money. And I think that's a really important thing. We know dollars are short, and I fear they might be getting shorter, and I worry that this important bit of work that's been happening in the last decade to really change the research landscape may well get a bit of a chop. We want increased transparency for the conduct of research, and the community is better informed about the value of research. We've seen that with COVID. Consumer and community involvement enhances the relevance of research questions and topics to make sure that it's meeting the needs of the people that it's aimed at. And policymakers and government agencies are better informed of consumer issues and perspectives. So they're the benefits of effective involvement. And I use the word effective. I mean, meaningful is a word that's bandied around a bit, but that has such a subjective thing, whereas effective is something that you can actually measure. So in conclusion, I just like to share with you what I think the ingredients for success for a research organisation is to have senior level champions. And I was fortunate to have, champions right the way through my almost 2 decades of working in this area. You've got them at TRI. Funding for dedicated roles, you've got that happening. Training is happening and resources are being developed or accessed. I don't know if this is something that is happening at TRI, but it's a goal of an organisation's strategic directions. If it's put on paper that it's important, it takes away if you want to involve community, and it replaces it with, we expect the community to be involved. And of course, the organisation fosters strong community. I think what you can bring to research is passion and interest in the research. I've been very passionate always about adding value to research. Your networks and collaborations are vital to helping researchers. And then, of course, there's expertise in consumer and community views gained from your lived experience, and that may be in a disease context, or it may be in the context of you've worked in this area or you've got a family member. It doesn't matter how you got that. It's about bringing the value of those views and that expertise into the research arena. And just to remind you always to stay on message that consumers add value to research, because I really believe where I've seen it, really change over the long time that I've been doing this work. And, I see lots and lots of results and still have contact with people that, I came together with in the 90s at the Children's Hospital, and then, of course, in the early 2000s. So thank you very much. I'd just like to finish off with a picture of Emma and Katie in 2019. So thank you very much for having me. It's been a pleasure, and I look forward to staying involved in part of the journey that you're undertaking at TRI. Thank you.
Some questions online. Oh, sorry. Okay, nobody heard what I said? Okay, so sorry, for a moment we just lost some contact. So I just want to really thank Ann for her time today, your expertise and your experience in this area, and we're very grateful for you to offer up your support and time to TRI today. So thank you. We've got a little bit of time for questions. I know that there was some questions online, which Alan can get back up there for me. And if there's anybody here that would like to ask some questions, that would be great. I might kick off, Ann, just by asking, TRI is in quite a distinctive position in that in this building we are predominantly biomedical research, a lot of fundamental basic science. We have an intersection of 4 different partners, but we also have a large industry component which is growing at TRI, and an intersection with industry which is quite unique, and commercialization and all the things that come with that. And so can you, my question really is, in terms of interacting with that intersection of industry and research and otherwise, do you have experience in that space, and do you have some advice for how we might go about making sure that we have consumer engagement at those intersections?
Yeah, I've had intersection with industry and biomedical science, etc. at Telethon Kids a bit, but through other national committees and things like that. But very recently, I shifted house very recently and I found some stuff. I'm a bit of a hoarder, but one thing my kids are always saying to me, throw it out, throw it out. One thing I didn't throw out was the agenda and notes from the very first forums that I held at UWA Untitled on Kids in 2004. And people from, various research groups around Perth came to that. And we had two separate ones, one for researchers and research organisations and one for consumers and community members. And the questions were the same. What is it you would like to see out of an I don't think we used the word effective then, but out of a consumer and community participation program? And it's quite interesting. So I would certainly suggest bringing together maybe in one event, because I think we've come a long way, but bringing together and asking those very questions. What is it you want? What do we need to do to make this happen? And what might stop it from happening? Those three quality improvement questions, what's good, what's not so good, and what can we do to improve it, I think would give you a good starting point, and you'll bring people on board and they'll tell you what it is that's needed, so you don't have to guess. That would be my advice.
Thanks, Anne. Good advice. So there are a number of comments on the chat line. Some of them are recommending people online to various priority settings, which is great. One of the questions, which I think comes from Leonie online, is I'm wondering if there are any legalities that need to be considered if organising a consumer group and regular community meetings with patients and carers.
Yeah, I don't know, Leonie, of any legalities as such. You do not need, and I've checked this with countless ethics committee, you do not need ethics approval to establish community reference groups or have consumer involvement in research. But legalities, I suppose the biggest legality would be about confidentiality. And, we've always worked with getting people to sign confidentiality agreements. And, once they understand that they could ruin people's publication opportunities or, grant applications, I honestly, in nearly 20 years, have only had one issue where, and probably looking back, we weren't clear about getting confidentiality agreements signed, where a community activist group sort of sent out an embargoed government report. That did not go down well. So that was when we sort of thought, okay, let's reassess here. But I think, so Leonie, I think the only legality would be about, confidentiality and, of course, health and safety if you're bringing people into your building.
Yep, thank
you.
So
I see there's another one there about co-design.
Yeah, this one's from Phil Carswell, and he asks, how can we integrate the principles of co-design into all research?
Yeah, co-design's an interesting word, and it's a word that's used a lot now. The jury's out for me about real co-design, because often, I've seen people say, oh, we co-designed this. Well, where was the consumer involvement in the deciding of what would be researched? And, we decided and then we went to the community. That's not my idea of co-design. So I think it's an interesting space and a lot of people are talking about it. And Consumers Health Forum are running a webinar very shortly. So it might be a good idea if people are interested to look at, the forum that they're running. And I think it's called Everything Co. And it's co-design, co-collaboration, etc. So I think there's some great principles out there, and I think it's about adapting those principles to all that you do.
And in terms of your experience and your with the larger funding bodies, I mean, most of the researchers that are in this building are tied to research funding that comes from NHMRC, MRFF, obviously also large philanthropic, organ and donors and otherwise. have you seen a big change, or are you confident in those organisations moving the consumer agenda forward?
Look, I think there is a real change in the landscape. The Medical Research Futures Fund, which probably your researchers would be applying for funding from, they have recently established a consumer panel, and they are looking at their grant assessment process and how they can better integrate that. So I think there's big changes coming there. I think other countries require it as part of a funding, application requirement, but we don't here. But I think MRFF, or the Medical Research Futures Fund, is looking to make those changes if possible. The National Health and Medical Research Council, they have a statement, as many of you would know, and I was on the writing group for that, and I spent 9 years on their various committees there. They're legislated as a investigator-driven organisation, so it's quite difficult for them to get around the legislation of that. But there's consumer involvement right through all sorts of things, and I've certainly seen a huge change to when I started, in early 2000s. So someone's asked about diversity. Could I?
Yes, we've got time for one more question from the chat, which is, what is your experience with attracting and working well with a diversity of people, especially those in harder to reach communities? And that's coming from Sally online.
Yes, Sally, great question, and never do enough about it. But in 2018, I think it was, we did a priority setting project with the University of Western Australia and an aged care organisation. And it was about, what are we doing for people who are living longer? We're all living a lot longer than what, my parents and grandparents lived. And but unfortunately, most of the research is about being sick or finances, and that's what it's mainly based on. And so they wanted to know if there were other things that were important to the community. We held we did a priority setting project. We did the survey, and then we held, they were themed, and we took the themes to the workshop. And at the end and the idea was to develop a top 10 list of priorities. And at the end of the workshop, the people there said, yeah, we don't really reflect the West Australian community. We are white, middle class, probably educated and self-funded retirees. So we went back to the researchers, and they sort of said, go forth and talk to other groups. So we've got a big multicultural centre just as in a suburb of Perth. We went to them, and they said, sure, come and talk. We have a meeting every Wednesday afternoon. Come and talk to them about what you'd like to do. So we went and talked to them about the project, and it was hard because there was mixed ethnicities, but we got through, and I hadn't worked with interpreters before, so it was quite tricky. Anyway, the long and the short of it was, people signed up to come to the workshop, and we said to them, they didn't have email, they used text, and that was the big way, or phone calls, but text was the big way. And we had 10 different groups, ethnic groups there. We had some paid interpreters, we had some interpreters from their own communities, and it was absolutely fabulous. What happened was that they were texting their friends saying, come down, there's food and they'll give you money, and they want to know what we think. And and so then we realised there were no Chinese people in Perth's got a big Chinese community, so we went and did a third workshop with them. But the second and the third workshop, the people, and it really stayed with me, is that there were no common issues, or there were 2 in the top 10 things, only 2. So if you're making policy for older people and only 2 common themes, you've got a problem, because your policy isn't going to work. And then the other thing is that stood out for me most of all, that those people said they never get asked anything. And, it was thank you, thank you, thank you. So fabulous. So that, just to answer, and I can make available that report if you want to contact me, Sally.
Thank you, Anne, and thank you for everybody who's put comments online and directed people to various other resources. So thank you, Anne, and you'll stay on for our panel,
yes.
please. Thank you. I'd like to invite Jessica Taylor as our next speaker. So Jessica has been involved with consumer engagement research for the last 9 years. She's a consumer advocate, MRFF grant reviewer and consumer review panel member. Jessica is part of a number of committees and has also worked with charities and federal and state health services. She's passionate about supporting research and setting positive changes to healthcare. Thanks, Jessica.
Oh, this one here. Okay. Hi, everyone. Thank you so much for having me here, and well done to TRI for setting up this event, and again to Benny for all the work to put this together. It's really wonderful to be working with you all and in this space. I'd like to talk to you about another perspective from a consumer. We just heard from the most wonderful Anne, who has been in this area for decades and really set up a lot of the early establishments and expectations of consumer engagement. So it's just wonderful to be able to build on that. And I'll try where possible to not repeat, because she had so many wonderful examples. I'm not sure. Here we go. So I'm a lived experience consumer, representing many voices, but also understanding that I only have my own personal experience, and everyone has their own, and you can only bring what you have lived through in your story. I work with the NHMRC and MRFF to review applications as a consumer assessor, and also assist researchers in reviewing their application before it goes to that stage, so that we can do a little bit of a preview around, are they engaging consumers? If they've said co-design, are they actually co-designing, and have they actually done that? And so giving them a little bit of an example and some guidance around how to best engage, support and mentor the new community of consumers coming through. I've been working in the space for over 8 years, primarily in the world of endometriosis, which up until recently was a condition that was very, very common, but not often spoken about. And I hope that you understand that through true collaboration that I'm going to talk about, we can take a cause which has been really deemed as women's business, and also not very gender diverse in the language used, to now where we have a national action plan with almost $100 million federal funding behind it. So I'd like to start about my journey. So where did I start? And I started by being curious, right? And I can encourage, and I would encourage consumers, researchers and organisations to do this. I started by being curious in my bedside in hospital after just being diagnosed with endometriosis. And I remember laying there going, wow, it's taking me 7 years to get to this stage. There must be other people out there. And I remember thinking, who are making decisions about the diagnosis of endometriosis, the education? Where does research play into this? And as a consumer, you can start to think about your lived experience or your story to understand where can you contribute and where might research impact your journey and your story. Then I became interested and a little bit frustrated with how researchers were engaging with consumers and the community. And I quickly learned that there were some wonderful researchers out there who were very keen to engage consumers and the community, and some that were not. And I wanted to know why. We learn about the research process and how there's really not a lot of time and money towards this, but we are getting there. So my research involvement has changed over time. I remember, again, being curious back in the early 2010s, where no one really wanted to talk about endometriosis. I remember going to GPs and asking them about the condition to try and learn, right? So again, being curious. And often GPs didn't want to talk to me. They didn't want to open up the conversation about what was going on in the research space. They didn't, they weren't able or had the model to talk to patients with a chronic condition, and they still don't. And so I often would pay for my own appointments where I would go to GPs and have them sit there and listen to me for 15 minutes. And I didn't have I didn't have any questions for them other than, you need to sit there and you need to listen to me talk to you about endometriosis so I can try and educate you, and we can try and build some of these puzzles and put them back together. So it was of my own expense, but I was again curious around who is in this space and where are the puzzles not talking to each other to make this picture. So this turned into networking, right? It turned into, this Jessica Taylor is coming to see me and giving me this education about endometriosis. And they started talking to their peers, they started talking to researchers. And through all of that, I engaged with a local organisation and very quickly took it over and helped re-establish it. With this and an organisation behind me, a consumer organisation, we then went out to researchers in the institutes to understand what is happening out there. So again, we were curious. How are those researchers developing research questions? Where do their models come from? Where does their funding come from? And we started to work with them and build relationships early around what would we all like to see. So those quality questions that Anne was talking about, what works, what doesn't work, and what as a collective do we want to see done better? This has moved huge. It feels like I've only been in this space in the consumer area for, not even a decade, but it has changed dramatically, and we are seeing that quite progressing quite quickly. Like to now, when I'm reviewing and assessing grant applications, I have been an AI or a CI on research projects. I'm training researchers, training research managers in how to better communicate and engage with consumers, and also put that into the application so that they can really try and support and improve their application for funding. There's lots of mentoring going on. There aren't enough consumers out there. So if we can share our knowledge and our experience with other people, we're really keen to do so, so we can get more diversity and more experience on these steering committees and projects. So what have I found works? Early engagement. This is all about relationship building. Building a relationship with yourself and with your story and coming to terms with that, as well as building a relationship with a researcher. It might be that you perhaps would like to Google, a researcher in the space. There are lots of different universities. There are people here at TRI and all of the partners here who are doing loads of different research. So building a relationship early can assist you in understanding where you might be able to contribute as a consumer, but also assist in the researcher, because they can assist in co-designing questions and priority setting if you can build that relationship early. Patience is a big one, and I'm not a patient person, but I'd encourage you to bring and have patience. As a consumer, being patient with the research process and the institutions and the systems. And as a researcher, having patience with the consumer, because they're often living with a lived condition, a chronic condition or something going on in their life. So like Anne mentioned, having two consumers as a part of a project is really key, so that not only that consumer has a support person, but if they're unwell, there is a voice at the table there with you as well. Support and understanding and networking for not only researchers so that they can learn what has worked in their peer circle, but also consumers. It can be quite lonely when you're a consumer with all of these very established and very well-regarded researchers, right? And so if you can build a network and support around you, then you'll feel much more supported and a little bit more confident when you're going into these rooms with these very seemingly powerful people at the table. I always come back to assessing my why, and I'd encourage you to continue to do this as a researcher and as a consumer. Why am I here? What am I contributing? who am I representing, and bring it back to the why. And it really helps to delineate between the me in this and the community in this, because as a consumer, you're often representing a community or perceived to be. So bring it back to the why am I here, and what can I contribute, and what other voices can come to the table. Barriers. This is still a really new area. And if I can build on what Anne mentioned earlier, when she was talking about her findings from 2009, and they were lack of time and money. They were not knowing where and how to start, and finding the right people. And recently I did a bit of work in consulting for Health Translation Queensland, who really wanted to understand the landscape around what's working, what's not working, and who's doing what, right? Because it's new and it's exciting, but who's doubling up? And I spoke to many researchers and many consumers and organisations, and these barriers in 2021 and 2022 haven't changed. People are still struggling with time and money, the processes. There is an education that's needed to understand the power of the consumers, because we can add value to a project. There is a lack of curiosity, and I would really encourage you to take away from this talk, be curious. When researchers are engaging with consumers, they often have a fear of this will add more time, this will add more expenses. But come back to being curious about that person's story and what perhaps they could add to your application or research project this time or future, because consumers really are powerful. They're in the community, they're also voters, and they're often engaged with other consumer organisations. Barriers to remuneration, and again, this is a personal choice, but we have just started recently within the Metro South area, at least, to talk about remuneration and how best this is done. And there's so many layers to that. Accessibility also stems from there. We do have a lacking diversification of rural and remote people. And so really trying to be accessible to all people. And I think hybrid models do help that, because we can have people, regardless of where they live, can join, which is helpful. And there are still, as a consumer, you can feel quite like an intruder and an imposter syndrome, right? Because there's often really powerful people at the table and you're not quite sure yet how you can contribute. So these are some barriers that I've definitely felt as a consumer when I've entered this. I've had to put my big girl undies on and walk in pretending that I am confident, but knowing internally that I'm really not. So again, it came back to my why. Why am I here? Where do I sit? And what can I contribute? So where do you start? And again, I'll say it again, start by being curious. Ask yourself, why am I interested? Why do I want to be involved in research? Why is it important to me to have research that translates into the community? Are you ready to share and talk about your story? Often that can be quite traumatic, and if there's not the appropriate support, it can be quite difficult to process what's happened as a consumer to relive those experiences. Ask yourself if you are ready to be in this space, and there's so many wonderful opportunities if you are, but really think about that why and be curious if you do have some barriers coming up. Reach out to universities. There are loads of different information and publications, even in the weekend mail, around what research is going on, and a very simple LinkedIn search, Google search, or connection with one of the research managers at a university or an institute like TRI. They can put you in touch with people, but the first thing is just to reach out if and when you are ready. And like I've said, we need so many more consumers. So if you are interested, we have people here like Benny and Jeanette who are really trying to work and build up those networks. You don't need to do it alone. We can support you. I'm very willing to share and mentor and connect people as well, because like I said, it's a very small pool and we really need to build it to really impact the very diverse and large group of research that needs to happen, not only in the next couple of years, but the decades to come. So finally, this is a photo of Dr. Sally Mortlock, who is a researcher who I've worked with for years at IMB in the endometriosis area, myself, and Monique Murphy, who's a Paralympian and also lives with endometriosis. And the beauty of endometriosis is many, many years ago, in 2018, it feels like many, many years ago, we came together with decision makers, consumers, researchers, and clinicians to understand what is working in the world of endometriosis and what needs to work, what needs to happen. So we developed priority areas. And since that time, those key groups in that collective have been able to advocate, lobby, and inform research translation into community. And we've been successful in almost $100 million for a cause that not many people spoke about, or that I had to go and pay GPs to listen to me about only not even 10 years ago. So there is real power here as a consumer when you work together with other people. And I would just encourage you to give it a go. And if you need support, we're here to help. Thank you.
Jessica, thank you so much for sharing your very personal story and your professional story. And we're really grateful for that. And Jessica is going to sit on our panel. So whilst we won't take any questions now, we'll save them up for Jessica on our panel. I'd really like to introduce Professor Rick Thompson. Rick is the research lead at QUT at TRI and a breast cancer research group leader within the Faculty of Health with QUT. Rick has worked in breast cancer research for over 30 years and has created collaborative programs in this area which combine the knowledge of researchers, clinicians, and consumers together. So thanks, Rick.
Thank you very much, Helen. It's a great pleasure to be here, and really want to thank TRI for taking these steps and also acknowledge the wonderful work, actually acknowledge the elders, past, present, future of the land we stand on, Turrbal and Yagara nations, and pay our respects to their elders, past, present, future. But yeah, also acknowledge Anne and Jessica for really nice talks, and really illuminating to hear from Anne, who'd done this work for so long. Can you hear me okay? So I'm going to just look at my notes as we go through, and I haven't got a presentation, just wanted to provide some experience that I've had with consumers. I'm a breast cancer researcher, as Helen said. I came back from 11 years postdoc in the USA in 97, and was really lucky that I was already exposed to a fair bit of consumer engagement and involvement in the US before coming back in those last few years through the early 90s. We started to have consumers present in our grant review panels. We didn't have a consumer rep at our cancer center. I was at the Lombardi Cancer Center, but certainly the tide was turning. And since then, I think you'll see and know that it's very prevalent there. So it's been a great precedent. I remember chairing a session in the US DoD Breast Cancer Research Conference where every session was co-chaired by a consumer. And I'm still in touch with my co-chair through Facebook, which is very nice. I was very fortunate to come back to a research program in Melbourne, the Victorian Breast Cancer Research Consortium. And this was a 10-year research program engineered by the institute directors there. And they had a consumer person, Avis McPhee from the Lehigh. She was a breast cancer patient, and she in fact had one of the very early bone marrow transplant, bone marrow removals, and then high dose chemotherapy, and then a return of her bone marrow. So she was really somebody who could bring that patient agenda to us. And so although we didn't have consumers in each of our groups, we had that at our core in the committee. I went on then, and in that VBCRC period, to have another VBCRC or be part of a VBCRC program on mammographic density. This is a particularly interesting area for me because it's really a consumer issue. And so it's a bit of a flip side in a way that I'm the visiting researcher that's, trying to help with that issue. But it's been a really interesting experience. This is, for those that don't know the amount of white on your mammogram is a breast cancer risk factor, but it also interferes with mammogram sensitivity. So it's something that's been a really big issue in the USA and was taken forward by a champion there, a PhD, who eventually succumbed to her breast cancer. But she was concerned, she was an education doctor, and she was very concerned that she found out that her radiologist and GP had known for quite 11 years of negative screening, that the screening may not work well because she had high density. So this is a big issue, and she led a movement called Why You Dense, and managed to get legislation, or led to legislation being passed in 38 of their 51 states of notification. It's not a great solution. It's been something that, because there's still a lot of unknowns about what you should really do. And also then that was all different in each state, and it's not coordinated, etc. But it's something that I've been, I think, privileged to be involved with. We have biology research trying to understand what is the risk factor that we do here with the radiology people. And, you know, we've had the benefit of Avis McPhee, but also Giada Evans from Breast Cancer Network Australia is very passionate about this. And I've been involved with consumers from the research as a researcher on this issue at a number of levels. Well, we established a website called Informed, INFORMD, mammographic density, to provide information, I guess, for the consumer about mammographic density. And I was involved with COSA Council, the Clinical Oncology Society of Australia, along with a couple of other people there that had an interest in this from the breast cancer perspective and also health economics. And we've set up a fact and issue sheet for that with COSA, which you can access online. So that's been an interesting area where it's been a lot of work with consumers rather than consumers being involved with our research work. However, we do have our research work, and we've been very fortunate to have the benefit of research guidance and advice from Leonie Young, who might have been the Leonie who asked the question of Anne, I'm not sure. And so she's a Brisbane researcher. When I moved to Brisbane in 2014, at the first breast cancer trials conference I went to, I discovered Leonie, and she'd been herself a breast cancer sufferer and somebody who helped establish the consumer advocacy group or consumer advisory group of breast cancer trials. And we set up, I guess, a relationship that sort of speaks to that early, Janine mentioned that start early. And so I think since then we've been involved and had a relationship across a number of projects. It's not all been plain sailing. I had a national network when I was in Melbourne, funded by the National Breast Cancer Foundation, so across 20 sites. And we were so fortunate to initially have a consumer recommended by NBCF, Sally Hodgkinson. And Sally was so instrumental in helping us and so engaged. She had metastatic breast cancer. It was a metastasis, which is the spread of breast cancer, was a metastasis-focused program, and so we felt it would be good to have consumers with metastasis. Unfortunately, the reason we want to study it is it's not a very good prognosis, and indeed Sally was very instrumental, and I think you just never know exactly where the penny will drop. And we had I'll never forget the committee meeting, a planning meeting we had, and trying to figure out our therapist had said, this won't work. You'll never see the criteria needed for clinical trials, the RECIST trials. And then we worked it. And it was really Sally who said, well, what about looking in the bone marrow and looking for disease change in the bone marrow, because she had bone metastatic disease. So we steered the whole program towards bone marrow analysis and individual cancer cells in the bone marrow. Because of her, unfortunately, she never made the first annual meeting, and we actually then had two additional, we went to BCNA and had two additional consumers from that, Nikki Aravanis and Jen Johnson, and they unfortunately also succumbed that year. And then we had Kim Birkenbrider, and she does have metastatic breast cancer, but it's a less advanced stage. And she's still active in the community and still working with some of the groups that were part of that network. And all of them brought, you know, valuable recognition of what it's really like to be in that position, engagement, etc. Very important things that's been touched on. Here at TRI, I've been, you know, more recently involved with as I mentioned, Leonie Young has helped me across a couple of projects, and we have this Centre for Personalised Analysis of Cancer. And Leonie, in fact, is involved as the consumer rep for our breast cancer stream. That's got 12 different cancer streams, but also for consumer training. We have a consumer research advisory group, which we've tried to establish there for each of the streams. And I think training is a very important thing. Certainly, I think you wouldn't, Anne and Janine would agree that having the appropriate training to sort of understand the processes and the needs and many of the things you've been flagging. So it's been a lovely relationship, and we have had, in a sense, some of the community chats. I forget the term Anne used. We've invited Leonie and her. She works at Wesley Choices with a support group for cancer patients at Wesley Hospital. She's brought some of those people, and we had an anecdotal kind of link with the Dragon Boat team from Currumbin, who happened to be at the Swell Sculpture exhibit. Went with my mum, who's a breast cancer survivor, and we created a relationship. And those who are here can see the mermaid, which was the front piece of their Dragon Boat, and was on display there. And they've come twice as a group and just heard from the researchers and met with the research. I think it's really critical and important. So I'm behind on my time prompts here, just to sort of come to some of the things like, well, the barriers, obviously the barriers mentioned by Jessica and Anne are very much similar. And I think time, you know, just time, enough time on either side of the equation, enough time from them and enough time from ourselves. I hadn't really thought about money, which Anne raised, and I guess that's a good point. It's important to know we do what we can to reimburse any out-of-pocket costs, but we haven't really got any honorariums, etc. And knowledge gap. I mean, I think this is really the key, and this is what it's all about: is them learning, or consumers learning, them what we're doing and how we're doing it. So I think there's a really valuable lesson there on both sides of the coin. You know, us learning from them how it looks, what's their perception of this, what do they see as the key needs, and from our side, being able to sort of educate a little bit more about the research process, what the elements are for collaboration, how we guide our projects with clinical interface and stuff like that. Well, that's my 10 minutes, so I better stop. I'll be happy to answer questions in the panel. Thanks, Ellen.
Thank you, Rick. And Rick's going to join our panel. We actually might ask the panel to start to come up to the front, and then I'll do some introductions. And again, thanks to all of the questions online and the points that have been made. We will come back to you. So look, the panel for discussion, and Anne is going to come back on the screen as well, which we'll make happen in just a moment. We also have Jessica on the panel, and Rick also. But I'd like to introduce the other panel members. And so David Milne has held a consumer advisory position with Metro South for a number of years. He's a consumer representative on the Metro South Research Council, as well as the Human Research Ethics Committee, and he works closely with a number of the strategic working groups. David is also collaborating with multiple research groups at TRI in the areas of oncology, inflammatory bowel disease, and genetic testing. David has provided important insights through his lived experience into these research areas and has first-hand experience in governance and policies of Metro South Health. So welcome, David, and very much appreciate your time on the panel. Before I direct a question to David, I'd like to also introduce AD McNary-Leo, who's trained as a genetic counsellor and now leads the group Integrating Genomics into Medicine, or IGM, at the University of Queensland Diamantina Institute, which is part of TRI. AD has extensive experience in genomic education, and her research programs aim to empower patients and clinicians to optimally utilise genetic testing. Of relevance to this discussion, Aideen is working with other researchers throughout the Faculty of Medicine, University of Queensland, to promote consumer and community engagement and involvement and develop processes which facilitate engagement. And I introduced both David and Aideen together because they have also worked together in this space as consumer and researcher. So I wonder, before I go on to introduce the other panel members, David, whether I could ask you to give us a bit of your personal experience, but I wonder if I could direct a specific question to you, which is, what has been your inspiration to begin your work in consumer involvement? And we've heard already that this can be a difficult space and there's barriers and otherwise, but what keeps you going, excited to continue in this space?
The inspiration, I suspect, goes way back to family upbringing. I'm the odd one out for having followed a teaching and learning pathway, career-wise. Everyone else was involved in medicine to a greater or lesser degree. So lots of conversations around the dinner table about medicine and research and so forth. In terms of inspiration, I first came to the TRI 7 years ago as part of a Brisbane open house event. And I was attracted to it for all sorts of reasons, not least of which the wonderful architecture of the place, but also the design principles, the juxtaposition between researchers and clinicians, the enforced meetings of both to discuss and get over some of the silos that are perceived to exist. And I think the design of the building has helped significantly in that regard. In terms of inspiration, well, I regard it as an enormous privilege, as I'm sure Jessica does, and any consumer, to rub shoulders with clever people. That sounds a bit trite, but it's not meant to be at all. The power and the energy and the intellect just within this one institution is absolutely enormous. I know of no other building. Oh, well, there are other buildings, sorry. There are other medical institutions, clearly, but here in Brisbane and elsewhere. But the significance of the research that is undergone and then translating into the commercial world where we as consumers can benefit along with everyone else from the power of that research is positively inspirational. And if I can play a very small, perhaps insignificant role liaising with early career researchers and others in nudging or seeding an idea, then that will keep me going, hopefully for a long time.
Thank you, David. Aideen, can I go to you to ask you from your perspective, what's been one of or inclusive of some of the most valuable parts of a consumer researcher relationship to you?
Yeah, so I think going back to actually interacting with patients, I've often been surprised in doing qualitative research with them. I've often been surprised at what they've said. I thought I had a pretty good handle on what was going on and all the rest of it. And then people will say something that really came from left field to me, to be honest with you. And other things that stay with me as I kind of thought about, I thought I was doing okay, but actually it turns out that wasn't the main priority for this person. And so I would say the main thing for me that I get from all the conversations with David and with other consumers is that it resets me, it grounds me. It makes me think about what I'm doing and why, and how much of it is intellectual satisfaction and how much of it is actually of relevance to the people I'm trying to help. So, yeah.
Thanks, Aideen. I'd like to introduce Michael Ital, who's a consumer advocate who's worked closely with the Lung Foundation. Michael provides valuable insight into the area of lung cancer, progressing research projects with TRI researchers and clinicians. Michael has also travelled nationally and internationally to promote the benefits of consumer voice in positive outcomes in medical research. So welcome, Michael.
Thank you.
Might also just take the opportunity to introduce Arutha Kalasinga, who is an NHMRC Research Fellow and Group Leader with UQDI here at TRI, working in the field of immuno-oncology with a focus on lung cancer, head and neck cancers, and more recently COVID-19. Arutha works closely with the consumer and consumer organisation throughout this research. I introduce you together because, again, you also have some links together and some relationships. We were having a discussion earlier on, actually, and I wonder, Michael and Aretha, whether you'd like to make some comments in general, but you recently travelled to an international conference where you were both there, and
Yes.
different inputs from the consumer versus research lens. Michael, do you want to make a comment?
Aretha is a terrible driver. Look, it was, as a consumer, to be able to not only attend the world stage, but to have a researcher that you admire and support and are a part of their research, I think was an absolute eye-opener for me, particularly as a consumer when you attended a world stage. We made comments about how you feel overpowered when you're entering a group in an advocacy space for the first time at a table with a team to discuss research. Well, times that by 10, maybe 100, and every time you attend one of these, that's what it feels like every time you have that conversation with any person at a world stage, because they are the top in their field in the world, standing in front of you. And I've had many moments where I felt about this big, but you know, I certainly gave an image that I was bigger. I just went like this and said, I have lung cancer, but I have muscles. You know, I'm strong. But you know, having Aretha there with me certainly helped me put a different lens on what I was looking at in the information. I had the opportunity to watch him present. Had an opportunity to sit on a panel at the world stage, and also engage with other researchers in the field that he's currently researching in. So it was very invaluable for me. Yeah.
Aretha, what about for you?
Yeah, it was the World Lung Cancer Forum in Vienna, so about 10,000 people in person, and it was incredible to be there with Michael and just being able to bounce off, you know, different sessions, and he was sending me, you know, screenshots of abstracts he was at and things that I was at, and you know, it was just bringing all of that into context.
Yeah.
And then Michael's treated at the PA, so Ken O'Byrne was at the meeting too, so we all were just pinging each other through, you know, WhatsApp and Signal and different forums on things we were learning, and just different forums. And it was great to be at the meeting with Michael and seeing, you know, not just the basic and the translational work, but you know, what about, you know, COVID and cancer and COVID and lung cancer, and what does COVID mean for lung cancer patients in the longer term, and sort of discussions around that. So it was fascinating to be there with Michael.
And I suppose you enjoyed the patient lounge. We get very spoiled. It's only for patients. It's very interesting to watch when head professors walk in and they get escorted back out. This is for patients, unless you know someone. Oh, okay. And then you wave and say, come in, Ken, you can come in, mate. It's all right. And, you know, being able to introduce Aretha to other world advocates, you know, the KR kickers and Kraz kickers, you know, and people alike. It certainly opened both our eyes up about, you know, what other advocates know and what they're doing in the other world, particularly when Aretha gives me the interpretation. Aretha said to me that these words hit hard. We met a group, a lady, and we walked away, and Aretha said, I'm glad we just walked away because she knows more than me. And she was a patient advocate, and I said, I was out of my depth at that conversation. I went, really? Well, that's interesting.
I'd like to introduce Ruth Cox, who's the Director of Occupational Therapy at the QE2 Hospital in Brisbane, which is part of Metro South. Ruth is passionate about consumer partnerships and health service quality improvement and research. She's a PhD candidate at Griffith University, is learning so much from her supervisors and the consumer co-researchers that she works with. They have co-designed a capability development framework for successful staff and consumer participation in healthcare quality improvement. So Ruth, I'd just love to ask you the question about co-design then, because this has come up a couple of times. What's your experience been with co-design, and particularly where has it been tricky, and how have you navigated that with your consumer partners?
I think the key with co-design is that it's iterative. just asking someone's opinion isn't co-design, and often people use it in that way. So in my PhD, so far we've had 39 meetings, consumers, co-researchers, myself and supervisors. So you can see it's very much a partnership where decisions are made together. And I think that's the key about co-design. It's about that decision making, not just asking someone a question and taking away what they say. And it's also, I think, about the whole process, the whole research process. So right from the design through execution and then translation. So I think if you've got those elements, and of course key things like mutual respect of each other's expertise, because we all have different expertise, and that's the key to it, then that for me is what co-design really is about, or co-production too. Lots of co-words, as other people have said already.
Thanks, Ruth. And last but certainly not least, I'd like to introduce Christine Heath, who's on Zoom. Christine's a cancer advocate from South Australia and is currently involved with research projects sharing her lived experience in the area of familial blood cancers. She also works with the Leukemia Foundation, raising awareness for cancer patients and their families. This year, Christine has had an active role as a consumer representative on a policy development committee. So welcome, Christine. I wonder if I can ask you a question about that space, Christine. So policy and consumer involvement and advocacy, the setting of priorities and otherwise. What do you see has been, difficult areas there, or where can you see the advancement? And what could we be doing at TRI in that space or with the partners?
Yeah, well, thank you very much for letting me be involved in this. Good question. Yeah, I think like a lot of the other consumer advocates, we just want to be heard. We want to be involved. We want to be listened to. We want our experiences to be understood and heard and acted upon, and getting feedback. My involvement with the policy earlier this year was really beneficial. 3 years ago, I underwent a bone marrow transplant, and so the policy writing that I was involved in was looking at people undergoing, people with a rare blood disease. Mine was MDS. What are the ideas that doctors and specialists, what do they need to know about for patients? What are their experiences, and what can they improve on their support of patients? And so I found that really, really cathartic, I suppose, and helpful in my own healing of the journey, because it's like a lot of us, our journey is a long journey, and it's still ongoing.
It's a long journey for you and others. So what advice would you give other health consumers or those people interested in taking the first steps in getting involved into health research? What would be your advice to them? We've heard lots of different bits and pieces, but what would be advice to them?
Are you asking me? Or yeah, just do it. It only helps yourself, but it helps others. The reason why I got involved is that it's a familial blood cancer, and we didn't know it was familial until my brother and I were both diagnosed within a month of each other, having lost our father to the same disease 10 years previously. And then the light bulb going on that, gee, what about our children and our children's children? What can we do to help them and make sure that that research is going along the track to help them? So like everyone, it becomes a very specialist, selfish reason why we do it. So I just think if you can help yourself, then you help others, because I'm a school teacher, and I always say to my kids, ask questions, because if you've got a question, you can guarantee there are 5 other kids in the class who's got the same question. So just help each other, get involved.
Thanks, Christine. I'm going to open this question up to all of the panel. We've talked today a lot about people's lived experiences, and many of the speakers today have talked, and Rick in particular, about losing people along the journey and otherwise. So what do we need to do from a consumer and a research, and then more broadly, and Ann, you might want to comment on this first, to really provide support in what is, can be very difficult times for the consumers, and how do we help to support researchers when there is that very emotional component to people that they have a relationship with who are having treatment or having difficulty with treatments or otherwise. And is there some guidelines, some boundaries, some helpful support material? What do we do to make sure that we're looking after everybody in this space?
Sorry, I was on mute. Look, I think it's a tricky one, and it is difficult. And I attended a training workshop in England about, dealing with this issue, and about the many hats that you wear as a consumer advocate or patient or public person they talked about there. And I think, there's a risk of oversharing your story. When I was the chair of the Health Consumers Council, we used to put consumer reps, this is in Western Australia, we used to provide consumer reps to the Department of Health, and we used to survey the chairs of the committees that had consumer reps on and just ask for any feedback. And the feedback always was about being able to provide a wider perspective and not just about your own story. So I think there's, something that we need to talk to consumers when in training, etc., about, the power of the personal story, but when it's appropriate and when it's not, that's something we don't do. And the other thing is about the chairs of these committees, the researchers, need to understand that they need to have the conversation with the consumer reps about, what do they want to happen if they share their story and they get upset. Because I think it's something that we're not good at talking about, these tricky elephants that sit there. But I think it's about relationships, and we, as I said before, we have them all day, every day, with our family, our co-workers, people we interact with in services. But, we manage those relationships. But for some unknown reason, when we get to these situations, everybody gets a bit silent. So I think we can talk with consumers about using your story effectively. And that's the thing is, not overusing it, but using it and what you want when and if you might get upset, because it can be very upsetting for people and can trigger things. So I would suggest that, it's about having those conversations in training.
Thanks, Anne. David, did you want to make a comment? Or anybody else on the panel?
Above all, I'd say to give people who have a particular disease a sense of hope above all. And what I mean by that, my lived experience happens to be with melanoma. It's very common up here within Queensland. Had I not been a participant in a range of programs at various good people's invitation, Aideen and her colleagues, I wouldn't know about a range of interventions which are in the developmental stage and beyond. For example, there's an ASMID scanning study. So there was a very early stage of a tetrahertz laser study, which is from UQ, which I've been a participant in. There's a conference we had here for a day and a half on polygenic risk scores. Now, all of these are leading towards a situation where early intervention of people with melanoma will be accelerated, and then obviously reducing the amount of people who actually succumb to what is a pretty horrible disease. So above all, I think if I can play a role as a consumer and as a lay person to translate, in a sense, some of those things which are not necessarily confronting, but you need to have a reasonable, good scientific understanding of what it's all about. And if you can translate that just in day-to-day conversations with fellow people who might well have been identified with various BCCs or SCCs or whatever, and give them a sense of hope, which is well-founded, that we're on the road to actually, if not solving forever, but really reducing the prevalence of that particular disease, then that is an important thing that I can do as a layperson.
Rick, did you want to add one?
Oh, yeah, just from, is that on? Was on. Yes, that's good. Thank you. Yeah, just from the research side, just I think to sort of put a bit of a positive spin, obviously that was extremely sad and very difficult for us, but we had on the flip side that, in a sense, confrontation with reality about what we were doing and what it meant, you know, to individuals. And I think not just for us in the room, the committee, but also for all the people that work with us. And it gets a little bit dogmatic sometimes. You've got a goal, you know, you're going, you write it out, but you forget about what it really means. So I think there is really, you know, in addition to all the other things we've talked about in terms of the benefits, having that exposure to the individual situations is really, really positive.
Yeah, I just wanted to add to what Annie said about, you know, when you, as a patient advocate, when you're sharing your story, and I think it's a really important point. You know, it's something that always sits in the back of my mind when I speak. I have about 7 different slides and speeches I can give, depending on my audience. And Aretha, you know firsthand in the conference overseas, you know, I've had discussions with Aretha about it, and, you know, you're bouncing ideas in terms of, you know, how do you want to, you know, for me, if I share my story, it's really important that I stand up for the other people, not for me, but the people that can't walk. So it answers your first question on that little slide you've given, and the last question for, if you want to be a patient advocate, you have to ask yourself not only one why, but ask it 5 times to yourself and see what answer you get. When you really drill down to what you want to do, you eventually end up, you know, yes, there's that self-knowledge, but at some point in time, particularly for the disease I have, when you stop for a minute and look around you, I'm actually very lucky to be sitting here walking around, very lucky. And that person is not so lucky. So can I be their voice? And if so, learn more of that. So I make it a point when I go to a world conference, I don't attend my disease conferences, I attend the other ones, the smoking mutations, KRAS, mesothelioma, anything but my own. And I think when you start thinking like that, you start to speak like that. And then when you speak like that, I think you'll be more powerful at a table, because you're not talking about you anymore, you're talking about the situation and what you can do about it.
Jessica, what's your view?
I think it really comes back to the role and the responsibility, and also who you're talking to and what message you want to get across, right? So think about the delegates in the room. What is the most important message, or what are you trying to deliver or educate them on? And sometimes it might be a media pitch, so getting your story and the emotion behind that's really important to raise awareness, right? But if you are at a policy decision table, bringing that collective view is equally important, yeah? Or if it is to inform and develop priority settings for the next 10 years of research, well, then you really do need to take yourself out of that situation and bring a very big collective view. So it's so situational, and if you can, like we've said, be involved in many different communities as a consumer, you can bring, although it's just you can bring some element of diversification of thought and experience from the community in relaying their experiences and stories or barriers. So it really does come back to role and responsibility from my perspective. Going down to how the consumer might be, you could do as much therapy as you can have access to, but we're all human, and so you might have really worked through your trauma or your experiences, and something may happen in your life that really brings or re-triggers you. And so having access to EAP services, which a lot of hospitals do and a lot of universities do, ask yourself as a consumer, will I have access to that if this is a concern for me? or if you can engage with a consumer organisation, and a lot of big bodies have counselling services. The Melanoma Institute have wonderful services. If you're engaging there, as a consumer, who and where can I get access for mental health support if it's ever needed? Just to prepare yourself and put some tools around you, because it can be exhausting at times to help and share. And that's why I said, please bring more consumers to this network, because we would love more diversification of thought and ideas and experiences, and also to share the load.
Thank you. Anne, you've got a comment to make?
I just want to say, just to add on to that, I think that it's really important to have more than one person on a committee, because if you've got a second person there, you can share. And if the person who's running the committee, the chair or, you know, the chief investigator, you know, is aware of a dynamic between the two of you, you know, from having a cup of coffee or, you know, just simple things like that. They're the sort of things that you can do to protect yourself. And, you know, as just said, you know, find out what supports are available for you. But I think it's really the responsibility of both the researcher and the community member. Thanks.
Just we're coming towards the end of our time, but if I can just pop in a couple of questions. There has been some questions in the chat, and this was a theme throughout some of the talks, is how do we appropriately recognise consumers? And so there was a question in the chat, do you have any advice on appropriate honorarium payments? I guess remuneration is an issue, but I'm also interested to touch on acknowledgements and maybe what our researchers currently do in terms of acknowledging on papers or posters, presentations, whatever that looks like in the research sphere. And I guess the third part for us also to consider is the training and support to ensure that consumers are able to assist researchers in the space. So I'm happy to open this one up to anyone that maybe, Ruth, you've had 38 meetings already with consumers. How will you be recognising them?
Yeah, so co-authorship of publication, I think, is absolutely key. And the two consumers I work really closely with, they get such a buzz out of that. Seeing their words and seeing their work and seeing them recognised, I think is just absolutely so important. Even things like bring a cake, have a cup of tea, have a chat before and after. You know, I think that everybody gets positives out of that. And I think that's also a really key part of recognition. I am quite passionate about consumers being remunerated. I think that's really hard as an early career researcher. I've been unsuccessful on about 4 grants where I've asked for that money, and I've been successful in getting little bits to be able to pay them to say, look, thank you so much. I wish there was more. But I think that's a really big area, particularly for early career researchers, where they may not be, you know, I'm not in the space of being able to go for, you know, huge grants at the moment. So that would be one area that I would really encourage, try to look at, you know, is to have that ability to be able to remunerate. And Health Consumers Queensland has very clear guidelines about that. And I think for me personally, that's where I go for my information.
Can I just add, although it's a great tool, it is very out of date in regards to inflation.
Okay.
So if we're going to look at that particular guideline, which is wonderful, think about,
is it 2015 or
2015?
Yeah.
So think about the 7 years now.
Yeah.
Think about how can we apply inflation. And Beck Jensen uses a great inflation tool calculator that you can Google, and she does that in her research.
Right.
So some of the health services have remuneration schedules and otherwise now. David, are you aware of that across Metro South or for consumers?
I am aware of it, and it's been frankly very rewarding as of January of this year to be a member of HREC and actually have a form of acknowledgement for the hours you put in. Clearly, I think there's an element of negotiation. It's only higher level committees within Metro South Health which are deemed, which have consumer representation, which are deemed to be important enough to remunerate their consumers. There is a plethora of involvement of consumers, if you like, at lower levels of committees, and their work is extremely valuable, but the pot is not big enough, unfortunately, to remunerate everyone. I'd just like to echo the point I think Jessica made. I was involved in just doing a literature review from early career researchers. I was probably a bit flippant. It's only a few hours of my time on that, doesn't really matter too much. But I found my name actually on as part of the participants of the publication. And on reflection, I thought, actually, yes, that's quite nice to be acknowledged, not in a monetary form because that's not appropriate, but to have an acknowledgement that you're there, having chipped in a 5 pennyworth about reshaping the final submission is kind of heartening. And so I think that there are ways, whether it's bringing along cakes on the day or whether it's an acknowledgement and a literature review or something like that, there are ways and means of being clever and innovative about rewarding consumers, I think.
Christine, you've got a comment?
Yeah, one thing that I always like is to hear what the response has been. So on a couple of times I've helped the geneticist team by being the story behind why they're looking for a grant. And it's always really pleasing to find out later down the track whether they are successful or they're not successful in getting that. So whether my time and my effort and to support them, has that actually worked? So I'd really strongly encourage people who are researchers, if you are using consumer advocates, to give them feedback about how the project is going along the way.
Yeah, so that feedback loop is really quite crucial. So we are at time, but I wonder if I could just ask all of the panel members one final question. We might go around the room. From your perspective, what have you found to be the most valuable part of your consumer researcher relationship? We'll start on with you, Aretha, and we'll go around.
I think can you hear me? Yep.
Yep.
I think it's just developing that relationship, and it's an organic relationship. I always tell Mick, near my house, we've got 3 bus stops and Mick's on all of them. So I can't walk past them. He's on, all the Lung Foundation Australia pieces. And it's just, Mick's on our lab meetings. He's part of our, publications, our reports, our grants. We should, when we get successful grants, I think you were the first to get back to us on a recent Cure Cancer grant applications, like when's the party? And it's just, you've got that really good organic relationship with the consumers. And it also motivates the team, the postdocs, the RAs, the students. So it's an ongoing relationship we have with Mick, and you're part of the lab essentially with us and part of this journey. So yeah.
Yeah, thanks, Aretha. Yeah, look, likewise for me with the relationship with Aretha and any research member that I'm a part of them, getting to know the person and what drives them to do that research is a very interesting, hearing their story. We know our story, but we're interested in the researcher story. Why are you in this field, the worst field in the world you're in? Why are you here? And then I got to learn a lot about Aretha and what drives him and where his compass points. And it's very humbling to go, I really know this researcher and I believe in what he's doing, and I believe even more now. So it inspires me to further push and connect him further and deeper in the space. So I think it's a very important part of being a consumer advocate and building that relationship with your team.
Rick?
Thank you. Yeah, look, I really echo around those comments around the team. And I think that's the thing, that it's a better team. It's, and I think certainly in terms of acknowledgement, all of them need acknowledgement, but that's the thing that makes me feel the best about the consumer involvement and the community engagement is having that team.
Hey, Dave.
Right. Yeah, I think I would just echo what everyone has said before. I mean, I think the relationship in itself is an incredibly rewarding thing, and I think I've just made very good friends as well as, I mean, obviously they're part of the team, and also we have a very diverse team. So some of members of our team have had no firsthand experience with individuals with the condition, and so having our consumers involved just brings a whole new area of drive and passion to the group in terms of the importance of what we're doing and why we want to do it.
For me, I feel, and we've touched on it here, it's quite a privilege to be connected with researchers and connected with community and seeing what decision makers and researchers' decisions and how they impact the community, whether it is in diagnosis or management or the translation. So it really drives me to see, you know, such a work in progress still, and a deep need to bridge that issues and those gaps, not only in the condition that I've worked with, but now even more broadly. There's again a disconnect between researchers and consumers and their engagement and co-design, which is what we've talked about here. So for me, what drives me is this unmet need, and yeah, for my sins, I'm in it, and it really inspires me to keep going.
Probably from my perspective, yeah, it's that learning. Constantly the consumers I work with say, why, or what does that mean, or so what? And that really drives me, because I think, oh my goodness, you know, a bit like what you were talking about earlier, it's the perspective that you don't think about when you're in your own little box, and so to broaden that perspective is so exciting, and I feel like I'm learning all of the time, and that we're learning together as well, and that's really satisfying.
Two things, really. I'm a complete sucker for lifelong learning. I actually had a job with that title at one stage, and I find it intellectually curious when you're going through an HREC submission or something, and it taxes the old brain cells that I've got left and makes you do a little bit of background reading so you understand fully, so you can evaluate it. So I find that tremendously stimulating. And the other thing, Aidan alluded to it earlier, I, not in a self-effacing way, but I have no formal training in science at all. I don't really understand what goes on the bench up there, particularly, no claims, but I have a wealth of experience in other sectors, in teaching and learning and organizations. And it's a constant source of surprise and uplifting, you know, in a sense of self-worth, that I can pick my experience from running organizations, schools, particularly in university departments, whatever, and elements of that seem to be wholly and completely relevant within the context of clinical research. And it's a great surprise to me, and a delight that that is the case. And so as a retiree, an active retiree, that gives me an almost sense of purpose. Oh, I'm still useful. And if other people are benefiting from those few suggestions you might make, because the analogy, which I often draw, and it's hardly terribly original, but all researchers really are deep miners, and they have lots of shafts going off and so forth. And from the consumer will understand broadly the infrastructure beneath the surface, but not the detail. But I have the luxury as a layperson to read a lot about what's going on the surface. And so it happens more often than it probably should do, that I'm in discussions with a researcher and say, oh, had you thought about X? Or that reminds me of. Or do you see any commonality between that and what you're doing at the moment? And it's just because I have the luxury of being able to read broadly on the surface of the mine and not get too involved with the detail of the mine shafts. And I think that's at its best, is a very healthy and constructive symbiotic relationship between researcher and consumer.
Christine?
Yeah, I echo what everyone has been saying, but also for me, it's my way of saying thank you to the researchers and the scientists that have been doing all this work, you know, yeah, because without the researchers, you know, stem cell transplants, you know, wouldn't be so prevalent today. And you know, yeah, so it's just my little way of saying thank you. If there's anything I can do to help you progress the research and forward your research, then let me know, and I will do it. So thank you for me.
And the last word is with you.
I'm trying not to have that you're on mute, Anne, so sorry for the delay. Just quickly, look, I think, you know, what's inspiring, what drives me is the enormous change that I've seen happen across the country. I just think it's so exciting to see you know, researchers come to this space and realise the value of it. And then, of course, for me, there's the hundreds and hundreds of people that I've come in contact with throughout this period of time across the country. And I really value that because there's such inspiring stories out there. And I'm always in awe of how valuable and important these people and their stories and contributions are.
And on that note, I would like to thank everybody, including yourself, Anne, Christine online, and all of our speakers who are here today for the incredible candour at which you've all spoken today and given to us inspiration as well as lots of thought-provoking things about what we should do at TRI. We will take Anne's line of consumers add value to research and put that everywhere that we possibly can. And bearing in mind that our vision is exceptional science and healthier lives, and we can't do that if we don't have these important links to community. So just like to thank everyone, and particularly Benny, for all of her work putting today together. And we'll invite you as soon as we can. Oh, yeah, thank you, Benny. I'd like to invite everyone online as soon as we can to an event here at TRI for some tours of the building, some introductions to researchers, and to make you feel part of TRI. And we look forward to the establishment of our consumer advisory network, community, whatever that might look like. And so thanks very much.
Thank you.